the 2-minute stretch that stops midnight leg cramps. Forever, let me ask you something. Does this sound familiar? You're finally in a deep, peaceful sleep, and then suddenly, bam. A pain so sharp and so intense jolts you awake. That muscle in your calf feels like it's being twisted into a rock-solid knot, and the only thing you can do is throw off the covers and stumble around on a cold floor, desperate for it to release. The next day, you're exhausted, you're frustrated, and you're left with a sore, tender muscle as a constant reminder. I want you to imagine something. Imagine going to bed tonight without that little bit of dread in the back of your mind. Imagine stretching your legs out freely without worrying about triggering that awful pain. What if I told you there's a simple, gentle 2-minute routine you can do right in your bed to help make that a reality? My name is your name, and as a physical therapist, I've guided so many people who thought these cramps were just a part of getting older towards finally getting a peaceful, uninterrupted night's sleep. In this video, we're not just going to go through the movements. I'm going to explain why this works and show you, step by step, the exact routine that has been a true game changer for so many. So, stay with me, because a cramp-free night could be just a few minutes away. The nightly nightmare. Why you're not alone if you've been woken up by one of these cramps? You know, it's so much more than a small annoyance. It's a violent interruption to your peace. One moment, you're asleep. The next, you're in breathtaking pain that can last for a few seconds or for several minutes that feel like an eternity. And even when the cramp finally fades, that muscle can stay sore for a day or more, a nagging reminder of what happened. You might feel like you're the only one going through this, but I want you to know you are so far from alone. These nighttime leg cramps are incredibly common, and they happen more often as we get older. In fact, studies show that a huge number of adults over 50 suffer from them. That's millions of us having our sleep and our quality of life disrupted by these painful muscle spasms. And let's be honest, the problem goes deeper than just the pain. It's about the feeling of dread as you get into bed. It's the fear of simply stretching your own legs. It's the exhaustion, the brain fog, and the irritability that can follow you all the next day because your sleep was broken. This isn't just a leg problem. It's a sleep problem, an energy problem, and a quality of life problem. But understanding what's truly happening inside your body is the very first step toward taking back control. Understanding the enemy, what's really causing your leg cramps. For years, we've all heard the same advice. You just need to drink more water or eat a banana. You need more potassium. And while hydration and minerals like potassium and magnesium certainly play a role, the real story is often much more complex. For many of us who suffer from these cramps regularly, the root cause is a mix of things happening with our muscles and our nerves. First, let's talk about our muscles. Many of us spend a lot of time sitting at a desk, in a car, or wearing shoes that cause the muscles in the back of our legs, our calves and hamstrings, to become tight and shortened over time. Think of these muscles like a rubber band that's lost its stretch. Then, when you lie down at night, your feet often naturally point downwards, a position that shortens that already tight calf muscle even more. It's in this shortened, vulnerable state that the muscle is ready to spasm. The second, and perhaps the most important, piece of the puzzle is what's happening with our nerves. Experts now believe that for many, nocturnal leg cramps are largely a neurological issue. The thinking is that muscle fatigue, combined with normal age-related changes, can lead to nerves that are hyperexcitable. These overactive nerves start sending faulty signals to the muscles, telling them to contract with incredible force, completely involuntarily. Sometimes, this nerve irritation doesn't even start in the leg. It can come from nerve compression in the lower back, sending those messy signals all the way down. This helps explain why some people still get cramps no matter how much water they drink. Other things can contribute too, like certain medications for blood pressure or cholesterol, overexertion, or even tucking your bed sheets in too tightly. So, the solution isn't just about one thing. It's about calming those overactive nerves and giving those tight muscles their length back. And that is exactly what our 2-minute routine is designed to do. The 2-minute solution, your step-by-step guide. Now, for the reason you're here. I'm going to walk you through the gentle 2-minute routine that targets both the muscle tightness and that nerve excitability we just talked about. The best part is how simple it is. You can do it every single night, right in your own bed. As the last thing you do before turning off the lights, we're going to break this into 2 simple parts. The deep calf massage, 60 seconds total, 30 seconds per leg. Before we stretch, we want to help the muscle relax and release some of those tender, knotted up spots. So, the first thing you're going to do is lie comfortably on your back. Take your right leg and cross it over your left, so your right calf muscle is resting right on top of your left kneecap. Your own knee is now your massage tool. Now, simply begin to gently slide your right calf back and forth over your knee. You are in complete control of the pressure here. As you move, you'll probably find a few spots that feel a bit tender or like a small knot. When you find one, just pause there. Apply some gentle, steady pressure for a few seconds, or make tiny little movements right over that spot. The goal isn't to get rid of all the soreness in one night. We just want to spend about 30 seconds gently releasing the tension. It should feel good, like a productive release, not sharp pain. After 30 seconds, uncross your legs and let's switch. Place your left calf over your right knee and repeat that for another 30 seconds. It's very common for one leg to be more tender than the other, and that's perfectly okay. The calf point temples, 60 seconds. Excellent. Now that we've relaxed the muscle, we're going to do the most important part of this routine, the gentle movement. That lengthens the muscle and helps calm down those nerves. Stay lying on your back with your legs out straight but relaxed. We're going to move both feet together. First, I want you to slowly point your toes away from your body, as if you're gently pressing a gas pedal. Feel the calf muscle shorten. Just go as far as is comfortable. Now, here's the key. Reverse that motion and pull your toes on both feet back toward your shins, as if you're trying to point them toward your face. This is the stretch. You should feel a wonderful, gentle pull all along the back of your calves. This movement, called dorsiflexion, is the direct opposite of the position that invites a cramp. That's 1 repetition. Let's do it again. Together. Point the toes down slowly, and then pull the toes all the way back up. We're going to repeat this gentle point and pull motion for about 60 seconds. Don't rush it. Feel the muscle engage as you point, and feel it lengthen as you pull back. If you feel a little cramp starting in your foot or toes, that's actually not unusual at first. Just ease up on how hard you're pointing or pulling. Listen to your body. And that's it. That is the whole routine. 1 minute of massage. 1 minute of this gentle stretching. Simple, easy, and so effective when you do it consistently. Building your cramp-proof routine beyond the 2 minutes doing this. 2-minute routine every night is a wonderful first step. And for many of you, it may be all you need to notice. A huge difference. But to truly make this a long-term solution, we need to talk about consistency and a few other simple habits. First, and I really want you to hear this, you have to be consistent. You can't just do this on the nights you feel a little tight. It needs to become a non-negotiable part of your bedtime ritual, just like brushing your teeth. It can take time to see lasting results. In fact, one wonderful study on older adults found that doing these types of stretches every night for 6 weeks dramatically reduced how often the cramps happened and how painful they were. So please, be patient with yourself and stick with it. Second, if you sit for long periods during the day, think about doing the point and pull stretch a few times throughout your workday right from your chair. It helps stop the tightness from building up in the first place. For even more benefit, you can add 2 other classic stretches. The standing wall calf stretch is a great one. Just face a wall, step 1 foot back with the heel flat on the floor, and gently lean in until you feel a good stretch in that calf. Hold for 30 seconds on each side. You can also add a simple hamstring stretch by sitting on the edge of your bed, extending one leg out straight with your heel on the floor, and gently leaning forward with your chest until you feel that stretch in the back of your thigh. And finally, one of the simplest tips of all, untuck your bed sheets at the foot of the bed. When your sheets are tucked in tightly, They can push your feet down all night long, shortening those calf muscles and setting you up for a cramp. Keeping them loose allows your ankles to rest in a more neutral, relaxed position. When the stretch isn't enough, red flags, and when to see a doctor now. This routine is a wonderful and safe place to start for most of us. But it's also very important to know when it might be time to talk to a professional. If your leg cramps are happening very frequently, several times a week, even after you've been consistently stretching, it's a good idea to have a conversation with your doctor. And please, pay close attention to any other symptoms. If the cramps are happening along with lasting numbness, weakness, or swelling in your legs, that could be a sign of something else going on with circulation or your nerves that needs to be properly looked at. Also, if a cramp lasts for more than 10 minutes and just won't release, it's worth getting it checked out. Your doctor or physical therapist can help rule out other causes and help you find the best path forward for you. My friends, we have covered a lot today, from the real reasons behind your nightly leg cramps to a simple, actionable plan you can begin using tonight. Remember, the key to taking back your sleep is consistency. This 2-minute routine of massage and stretching, when you do it every night, can help calm those overactive nerves and lengthen those tight muscles, creating the foundation for a peaceful, cramp-free night of sleep. So I truly encourage you, try this tonight. Commit to it for the next few weeks and just see how you feel. If you found this video helpful and you're ready to say goodbye to those midnight leg cramps, please take a moment to click that like button. It helps this video reach others who are struggling, and be sure to subscribe for more simple, practical tips to help you feel and move your best. Please share this video with anyone you know, a parent, a friend, a neighbor who is tired of being woken up by that awful pain. Here's to a future of peaceful, unbroken sleep. Let me know in the comments after a few weeks how it's working for you.